What's up, guys? So I posted these two questions today. Both of them are related to leukemia and lymphoma, but the main point of this video would be for us to review how to differentiate between non-Hodgkin's and Hodgkin lymphomas. So the first question, the concept behind the first question is that anybody above the age of 60 years old with generalized lymphadenopathy, the most common cause is leukemia lymphoma. So right away, we should be starting to think about leukemias and lymphomas. So that leaves us with all these options. So we have Hodgkin's, we have CLL, and ALL. Looking at the options and knowing things about Hodgkin's, we should be able to eliminate it, but we'll see in the next question how to think about Hodgkin's. And then ALL and CLL. So ALL, this is the most common leukemia found in young children, so less than 12 years old. That rules this out, and the only one remaining is CLL. Now let's come to Hodgkin lymphomas, which is very well represented with this question. So in this question, we have a 60-year-old woman, once again, and she is presenting to us with fevers, night sweats, myalgias. But now when you do the physical exam, you see that there is a non-fluctuating mass in the left axilla, and it has a contiguous distribution. So some big words. We'll just break them down, not a problem. Contiguous means one after another. So that means so in the left axilla, so that could mean that it's in that there's anterior, there's apical, and then going all the way up there's cervical, that type of stuff. So like one after another. And then non-fluctuating. So if this is a mass and I was to push on it from this end and this end, it would go up this way and go down this way. This would be a fluctuating mass. However, they're saying this is a non-fluctuating mass. So this usually means that this is a swollen lymph node. Knowing this, now we know that this 60-year-old woman has a contiguous distribution, unlike the first question, which had generalized distribution. And then there are these Pel Ebstein fevers. The fact that she is saying that she has had fevers for a few weeks and they've been coming and going, this is a Pel Ebstein fever, which is a B cell symptom. So this makes us think that this is a Hodgkin lymphoma. And most commonly, Hodgkin lymphomas are B cell lymphomas. Looking at the options, hallmark cells, we know that would be found in T cell lymphomas. Looking at option C, we see that the CD3, the CD8, and CD10 positive cells, these are referring to T cells. Generally, CD count less than 10, T cell. More than 10, B cell. Okay, so not this. And then D would be referring, so it's intracytoplasmic inclusions. Whenever we have inclusions, it is a good idea to start thinking about viruses, since so inclusions are basically just protein aggregates that have been left behind or that have accumulated. Since these are in the cytoplasm, we can tie in some microbiome and say that since they're in the cytoplasm, that means this is some sort of virus, most likely that has been replicating in the cytoplasm. So it could be a RNA virus. We don't know any RNA viruses that would be doing any of this, so not D. And those would be all RNA viruses except for orthomyxo, a huge high yield point not to forget. So that leaves us with B. But what does B mean? So CD15 and CD30 positive cells, one, the CD count is plus 10, so we should be thinking B cells. And this actually represents a Reed-Sternberg cell. These are nucleoli that are parallel to each other in one cell, which is classically CD15 and CD30 positive, and that is classic for Hodgkin lymphomas. So very quickly, that leaves us a couple things to differentiate between non-Hodgkins and Hodgkins. Hodgkins would have contiguous spread of lymph nodes, like contiguous involvement of lymph nodes. In non-Hodgkins, it would be generalized. All right, and then over here we will be having Pel Ebsteins fevers along with other B-cell symptoms. This would be a good way to like break down questions going forward.